Regarding ACell, I wanted to share with you a couple of our patient stories today. One is a male patient who had his treatment about a year ago. Previous to the ACell therapy, he was placed on Propecia, had been on that for about a year, and then had his ACell treatment, and since then has noticed a significant improvement in the density of his hair. Justin, it's good to see you.
Good to see you as well, doctor.
So it's been about a year since you had your injection?
Yes, it's been about a year.
All right. And tell me what your experience has been since then. Tell me if you've seen any changes.
So since then I have seen some changes. It definitely feels much fuller in the front, just thicker, fuller, and in the back. One of the things I noticed before was kind of wispiness, and that's really gone away. It feels like it's filled in the crown of my head.
And then after the ACell injection, did you have any shedding after that?
You know, it didn't really seem to have that much shedding. For the first couple months, I didn't notice like a increased volume of shedding. It was pretty normal, and it seemed to be a few months in when I started to see some change, especially up front, kind of seeing little hairs kind of coming back in. And
cool.
Yeah.
All right. Well, let me take a look up here. And part of this, you know, is subjective in the sense that it's not just how it looks, but how your hair feels too. Style's different for you, does it?
It does. It definitely does. It's just fuller.
Okay. So I think that we're usually in these ACell treatments where we really see a big change in men is right where they start to recede up in the hairline here. Yeah, all this is so much thicker and longer. This is the stuff that was really just short and wispy, you know, like, you know, these little tiny hairs here. And now look how much longer they are. So it didn't create any new hairs. It just took the ones that were there and just enhanced them so they became thicker and longer. One of the questions I was going to ask you about this was, when you noticed things start to change, did it happen gradually, or were there certain moments or times when all of a sudden it seemed to change to you in kind of a short period of time?
That's a good question, because it's not something that you notice right off the bat. So it was gradual over time, but there was obviously a point where it's just like, geez, this is starting to really feel thicker, and really starting to notice that. So it probably, first few months, not a lot of change, and then it seemed to really kick in and be able to notice it. Probably 3 months in, 3 to 6 month range, where it just, you could really see and feel the results, especially when you're washing your hair and styling your hair, and you could really feel the difference.
So moving forward, I think one of the things that would be helpful is just talk about, you know, what can you expect in the next year or so. And ACell can be reapplied. We've done that in some cases, and we've gotten some improvement above and beyond what we did from the first treatment. But I would wait and see how this develops, because it may not be finished in terms of its development right now. So I would wait at least another 6 months and then see how you do. All right, good to see you again.
Good to see you too.
All right.
Thank you.
The second one is a continuation of the series that we've done on Cami. Cami works here with me in the office, and we did her ACell treatment back in March last year. So she's about 10 months along. And I think the important thing to note about Cami is that she's had some steady progress, although not as dramatic as we like to see in some cases. There is definitely some improvement there that has made a big difference in the way she's able to style her hair and how she feels about her hair in general. What we try and do is just show the part line, which although it still has evidence of some thinning in here, is significantly better than it was initially. And we'll show some comparative photos so you can see the difference. There's a couple little landmarks in here, which are small little, there's a little strawberry hemangioma, little skin nevi on the scalp, which are normally seen. And these are definitely more hidden than they were previously. Let's have you tilt your head straight up here. So then on the hairline itself, did you see much difference in the front right here?
A lot.
Yeah. Okay. Yeah, see, these are these little hairs in the front, so they're significantly longer These are these little vellus hairs that are typically maybe a centimeter at the most, and now they're seriously a lot longer. And you can see that here in the temples as well. All this stuff was usually, you know, about again a 1/4 inch or so long, and now they're significantly longer. Some that were barely even there are getting to that level where they're, I can see them now, they're about 1/2 inch or so. But the best part, the thing that makes the density improve so much to the eye, is the fact that all those little vellus hairs are just slightly longer and thicker, in some cases a lot longer and thicker, and that adds to the total volume of hair that's up there. Let's see the other side here. Yeah, you're gonna have to do some work after I get done mauling your hair here. Okay. So, yeah, and this is where a lot of women end up noticing that their hair is thinning, because they get a lot of recession up in this temporal part of the scalp, and then their hairline stays intact, but it gets thin behind it. And so the ACell treatment, by increasing the density and the thickness of those existing hairs, the smaller vellus miniaturizing hairs, then it starts to make the forest a little bit thicker, and that's what improves the handling of the hair, the ability to style it, makes it easier to you know, camouflage any thinning areas. Again, it's not growing back to its original state of density, but a significant improvement. So your styling is easier. You're
much noticeably easier to cover my scalp. Absolutely.
Okay. All right. The best thing to do is to either email us, you can call the office, go on our Facebook page and send us a message, but tell us what you want to know. We're asking our patients and other people out there to tell us what they want to know so that we can give them the information that they need.